Hello people, I hope you are having a wonderful day and it's your friend Rana. So yes guys, today as you have seen the thumbnail, today we're going to discuss about the US medical billing and we are going to discuss about the US healthcare training process, like whatever just mandatory to know for a fresher or for those candidates who are willing to do a job in US medical billing as a medical coder or as a medical biller. I know there are multiple profiles are available and candidates should have knowledge about the medical billing, like how it's work and what kind of things come under the medical billing. There are lots of things and it's a vast, so it will take time to explain each and everything. But today we just going to take an overview. In this video we are going to discuss about that. In next coming video, how many chapter we are going to explain, as I know that I would have the 5 to 6 videos in this playlist. I'm going to create a playlist for US medical billing training process. But in today's video we are going to discuss about that how many things we're gonna cover in our next coming video, as today I'm going to discuss the 7 to 8 parts of US medical billing. And also, as you guys have known, that I'm working in a medical billing company which is known as Knackglobal. I'm a senior process associate in Knackglobal and I'm working as AR. So candidate who are just in their training process or in their evaluation test, who has done their interview and they are now in their evaluation test and they are doing their training, so it's video going to help them to clear the things out, and so the things are going to be easier for those candidates who are in the training process of the Knackglobal. Apart from that, it's video for all the people who just want to know about the US medical billing company and US medical billing process, and there are lots of things which you should know and you should have an idea about that. So let's begin and let's have an overview how medical billing works and what kind of things you should know. Yes, let's talk about the part one. Part one, what is the part one? It's an overview about the US healthcare industry and regarding that. So what is the US healthcare industry? It's a service center for Medicare and Medicaid services. Now you guys will worry about that. What is the Medicare and Medicaid? So don't worry about that. In next coming videos, I'm just going to let you know each and everything. What is the Medicare? What is the Medicaid? What is the Medicare parts? So it's an insurance which is just provided by the, what I can say, that the federal government of the US United States. So guys, yes, without wasting the time regarding the Medicare and Medicaid, we are going to go ahead. As I said that we are going to discuss about that part in coming videos, and that is the important part of the medical billing or the medical coding. So yes, we are going to discuss about now the health insurance terminology. So what is basically this terminology, and it's kind of language which we use to describe the patient health, patient diagnosis, and there are lots of things covered in this, like the Hippa codes, modifier, disease. This is the language what I can say that. So but before that, what is the health insurance terminology? So it's a simple thing which we can understand. It's a contract between the insured and between the insurance company, where insured mean a person who has the insurance, who own the insurance to the insurance company. So insured pay the premium part to the insurance company to cover his financial risk when he has got any disease or he is sick, like whatever he got any disease at the financial risk and he has the health issue. So insurance company going to cover each and everything. This is kind of health insurance terminology, so which is mandatory to know for you. So this is something you should know. So guys, as I have told you regarding the insurance terminology and the US healthcare industry, apart from that, let me just let you know when it started. It's started in 1930, and yeah, BCBS healthcare company was started also at that moment. And as I know that I am working in multiple BCBS insurance, I do work on that insurance, and apart from that, it's across the United States, so it's a vast company, we can say that. So apart from that, it started on a small scale and at the Baylor University, in the United States. So let's talk about the next parts. And yeah, we have discussed about the part 1 where I have explained regarding the US healthcare industry and only few things which is just mandatory to know for those candidates who just want to know about the US health. According to my experience, I'm just going to explain you few things. As you guys know that I do have the 3 years of experience in a medical billing as a professional medical biller. I'm working as a senior process associate. So without wasting the time, I know it's video going to be long, so let's talk about the next part, which is the Hippa. So yeah, as I told you that on each part we can just create a whole video and a proper video where I can explain each and everything. If you just want the video for each part, you can just do one thing. You can just comment below and you can just pin me, you can just text me on my WhatsApp number. I'm just going to mention my WhatsApp number at the end of the video. And yeah, if you want any video regarding the any part, you can just comment and I'm just going to create a new video regarding that process and regarding that part. So let's talk about the Hippa. So what is that? So yes guys, as we are discussing about the Hippa, so we should know about the Hippa full form. What is the full form of the Hippa? It's a Health Insurance Portability Accountability Act. As per the Hippa policy, you guys cannot share the patient information with any random person or with any random company. So if you are going to do that, so you can be behind the jail up to 7 years, you can be behind the bar up to 7 years, and there could be a penalty for you. So make sure you are not going to do that. Apart from that, as I have told you, if you want me to explain more about the Hippa, so you can just comment below. So I have told you that let's come to the next part. It's part number 3. So guys, yes, now we're going to talk about the part 3, and it's a terminology. So what is the terminology? So as I have told you previously, it's a specialized language to describe the patient health condition, procedure, treatments, and there are lots of things covered into this, like modifiers, HICPICs, ICD codes. So there are lots of things. I can make whole videos on this part as well. So in next coming videos, you guys will know about these parts, and you guys will have an idea about that, each and everything basically. So right now it's just an overview regarding all the parts. So in part 3 we are going to discuss about the terminology. It's a specialized language where we would have all the things which I have told you: treatment, patient health condition, modifiers, HICPICs, EOBs, coordination of benefits, assignment of benefits. There are multiple things which will come into this part. And what is going to be the part 4? So part 4, it's going to be the RCM, revenue cycle management. Which is my favorite one, where I'm just working on. So as I'm working as an AR, so this is my favorite part. So revenue cycle management is the cycle of a claim, life cycle of a claim, like how much time it's take. So like where we are going to explain each and everything. Previously I have also made a video regarding this about the RCM, what is the revenue cycle management. So you can watch that video. Apart from that, I can make a new video regarding this, what is the revenue cycle management, where we are going to discuss about the patient. When patient have a disease and he visit to the doctor, he provide all the information, his insurance information, all the details. After that, physician take care of all the information, and he just treat the patient, or he just provide all the medical treatment, whatever is required. So it's just about the claim, life of a claim, like how it's run. So we can also discuss about that. We are going to discuss about that, about the RCM, about the revenue cycle management. So yeah, we are going to have next video as soon as possible. So now come to the part number 5. What is the part number 5? So yes guys, the part number 5 is a very important part of the medical billing, which is mandatory to know for everyone. So guys, in part number 5 we are going to discuss about the insurance and insurance plan programs. As we guys know, we are going to discuss about the Medicare, Medicaid, Medicare, Medicare parts. As we know that Medicare has 4 parts: Medicare Part A, Part B, Part C and Part D. Every part has their own eligibility. Medicare has their own eligibility, Medicaid has their own eligibility criteria. So we are going to discuss about the next coming videos regarding the whole process. You can find my next videos into the playlist of the US medical billing. And after that, we are going to discuss about the Cobra. Cobra is also health insurance program. And then we are going to discuss about the no fault Medicare Advantage plan, like how much they are going to pay when you got any financial risk. So we are going to discuss about that co-insurance and like co-insurance, deductible, co-pay. There are multiple things. I'm going to explain each and everything step by step. It's gonna take time because, as I told you, medical billing is too vast, so it's take time to explain each and everything. So yeah, come to the next part number 6. It's a reimbursement methods where we are going to discuss about the fee and all. So it's not an important part according to me. So I'm just going to brief this part also in next coming videos into the where I'm just going to let you know about the plan and programs. So it's just an overview for all the parts. So yeah, in part number 7 we are just going to discuss about. So guys, yes, in part number 7 we guys are going to talk about the terminology. We are going to talk about the authorization, pre-certification. It's the same thing, don't worry about that. And yeah, we are going to discuss about the NPI, tax ID and social security number. There are many things we are going to cover in this video. What is this? And I'm just going to brief about this regarding this. And the part number 8, this is the next part of our whole playlist, and where we are going to discuss about that. So in part number 8 we are going to discuss about the time zone and some of the full form of the like ICD-10 modifiers, like Hippa. What is the full form about the RCM? So we are going to talk about those full forms in part number 8. So this is something which we are going to cover in our next coming videos. And yeah, in these videos, so make sure guys you are going to watch my next videos. And I know it's gonna take me time to create a whole playlist. I'm just going to make a video on weekends, and I'm just going to upload videos. Maybe we would have the 7 to 6 videos regarding the training process of the medical billing for the first week of training. And in next coming videos, if you guys are going in AR for the process associate, so there are different trainings for the process associate for AR, where we have to discuss about the denials management, calling scenarios. There are multiple denials where we have to discuss. So that's the different part, but this is the basic part where we have the 8 parts of the medical billing. So this is the important part for medical coders, medical builder, or anyone who just who is interested in medical billing and want to know about the more medical billing. So right now I don't have anything for you guys. If you do have any question regarding the medical billing or any question regarding any video on upcoming videos, you can comment below and I can just help you out. And for now, you guys must subscribe my channel and also press the ringing bell so that you guys can have more videos related to the information related to the medical billing. I know if I have made any mistakes, so just forgive that, because as I told you that I'm not a professional. But yeah, in this part I'm not a trainee, but here I do have the experience in AR. So according to my experience, I have explained each and everything as much as I know. So yeah, without wasting the time, we are going to focus on these things. If you guys are going to learn these things, make sure I make you guys that you are going to cover, or you guys are going to clear any interview in any US medical billing. If you guys would have an idea regarding all these parts, all this process, so yes, you are going to be unbeatable. You guys would have a good idea or the best knowledge about the medical billing. So thank you so much guys for watching my video. I know I have made few mistakes, but we are going to end up this video right now as soon as possible. And so bye bye for next video. Thank you so much.